Hi, I'm John Filardo, Senior Vice President here at the American Chiropractic Association. We're here on a rainy Tuesday afternoon, and I am joined by Brian Sutter and Tom Wharton.
Yep.
Brian is a partner at the Capitol Hill Consulting Group. Tom is a Senior Vice President there at the firm, and we've brought these folks on in June, I believe, to help us with this Medicare initiative. Why don't you folks tell our viewers a little bit about your firm and about your background as well?
Sure. Absolutely. Well, we're at the Capitol Hill Consulting Group. We're a bipartisan firm here in Washington, D.C., representing folks across the spectrum at the firm. But Tom and I here are leading the healthcare practice, and we've been together for over 2 years now, 2.5 years, and really have been able to build a little book of business in the healthcare world and really enjoy it. Tom,
yeah.
give a little background?
Just teamed up with Brian. I'm kind of the Democratic side of the equation. Obviously, Brian's background is with the House Ways and Means Committee, which is going to be central to our endeavor on getting this piece of legislation introduced. My background is I used to be the Senior Healthcare Policy Advisor to Senator Joe Lieberman. And then before that, I worked on the House side as a Senior Legislative Assistant to Congressman Dan Boren. And then post-congressional work, I was the Senate lobbyist for Blue Cross Blue Shield during the rollout and implementation of the Affordable Care Act. So I've been working in healthcare for about 15 years now, and teamed up with Brian to build out this healthcare practice at Capitol Hill Consulting Group. We've been working with the chiropractors here for about 3 months now. Love the work. Great team you guys have here in DC, and we're excited about the opportunity.
Okay, great, thanks. And let's just set the stage here a little about Medicare. I'll talk a little bit about that. This is a statute that we're trying to change. It goes back to 1972, and it's our folks. I don't think we have to go too much in depth about that because it's a statute that is very limited to the patient, and really the only thing that is covered is pretty much the adjustment. But there are so many other things that chiropractors can do under their state scope that are Medicare covered benefits. And as you guys know, we're not looking for anything new. We're only asking that if this is a Medicare covered benefit, like evaluation and management, post-therapy services, that can be done in a chiropractic office, that they should be allowed to do it. And their patients should be able to access that, right? Yes. That's really all that we're looking for right now.
Yeah, absolutely, and I think that's a great message. It's a pretty simple one to talk to members of Congress about. Really, we want to have access to the services that we utilize, and a lot of patients, as you all know, access their chiropractor outside of Medicare. But once you hit that Medicare age, it becomes limiting, and that's a real problem. And I think that's something. It's a very simple solution. It's less than a page and a half, 2-page bill, real simple. We just want to have access and be like any other physician in the Medicare program.
Yeah,
absolutely.
And from a talking point standpoint, I mean, who doesn't have a family member with a back ailment or back issues? I think we all have a family member with back ailment or issues. Chiropractor, my mom is, deeply kind of tied to her chiropractor, uses the chiropractor on a regular basis. And the fact that, when she turns 65, that her services are going to be a little bit more limited, I think would be, disturbing to her. I think that's a message that we need to take to members of Congress, both on the House and the Senate side, as we look to get this piece of legislation introduced in the next, couple weeks.
And I think, too, and this is something I sometimes forget when I'm talking to a member of Congress as well, is the opioid issue. It's something that's very hot right now. Yep. And it's one thing, sadly, I believe, is not going to be going away. As you know, we talked about this before we came on the air, that the Senate now is looking to pass an opioid bill that's got some good things in there. But I think it's very important that members of Congress know that we are a solution to the opioid because we don't prescribe.
Yeah.
But we treat back pain and other ailments, through physical modalities and so forth. So I think that's part of the message that's resonating with these folks as well in Capitol Hill, right?
Absolutely, and I think as you look, as this opioid crisis has gone on, I think Washington, D.C. has been looking to medical providers and physicians at the front lines treating patients to say, look, help us get this under control. And I think this is a prime example of chiropractors standing up and saying, no, look, we're seeing these patients when they're in pain and we're able to help them with non-opioid solutions. And I think that's something, again, that really resonates home. Taking ownership of this issue is important. Unfortunately, other physicians have taken a long time for them to really have ownership of this issue, but now it's coming to a head. So I think you guys are hitting the right stride at the right time, so keep on it.
Yeah, I mean, I agree. I mean, it's an issue. It's almost like the opioid issue has moved away from, kind of acknowledging the problem now to trying to find fixes to the problem. And everybody's looking for, I guess, non-prescribing ways to address, what everyone would agree is an epidemic. And I think it's a real niche for us as we continue to make our pitch to policymakers.
Yeah, as we do talk to members of Congress, this is one of the areas that comes up. Not only the unfair aspect of the current statute, but there's another component in there as well, is the whole answer to opioids. Yep. We're not the answer, we're not the only answer, of course, but we are part of the solution, and that is something that I know the three of us have talked to members of Congress, and they're starting to get it, I think.
Yeah. I mean, we don't have any statistics, but I mean, I just think from a general standpoint, everyone would assume that a lot of the opioid issue probably stems from back problems. So it's a natural fit, I think, in the discussion.
Absolutely.
Right. Now, before I talk a little bit about Grassroots and what our members can do and that kind of stuff, one of the things, we think, well, why don't we just go after this on the regulatory end? Why don't we just, march up to CMS and say, hey, look, this is something that can be fixed through the regulatory process. But we've tried that, and we've tried it with Tommy Thompson. Yep. We tried that with Kathleen Sebelius. We were right in their offices. In fact, I was in there when former HHS Secretary Sebelius, she assigned a person to work as a liaison with us to CMS to help fix this, as we call it, inequity. And it was always one of those one step forward, two step back thing, because we still contend that through the regulatory process, we should be able to get some sort of relief for our patients through the statute. But they've always come back and they've just said, look, we just have to change the statute. That's all. And the only way to do that is through legislation.
Yeah. And you're right. I think going the regulatory route is the right way to start up a process like this. You see what they're able to do. Oftentimes, the agencies are hesitant to do so, and unfortunately, you need to fall back to changing statute. The challenge with that, obviously, is it's a little bit harder. Yeah. Getting something passed by Congress anytime is a challenge, especially in this environment. But I think it's right. The clear reading of the text suggests it needs to be changed, so let's do it. And again, it's not a complex change. It's a very simple change, taking out a few words and just reaffirming the intent of Congress for what you're able to do. That doesn't mean the work will be over. We'll have to go back to the agency and say, hey, Congress has changed this. You need to implement it, and let's get it right. But yes, unfortunately, I think that's where we're at, is get a bill, get it introduced, and hopefully passed.
Yeah. I mean, I don't have much to follow up on that. We just need to get the legislation introduced, and I think we got good messages to the policymakers.
Yeah, and this was something back, going back, 4 years. I mean, in 2015, it was, near the end of the Obama administration. Again, we worked with Secretary Sebelius, and our House of Delegates, passed a resolution that, look, this is our top legislative priority. Yeah. We've got it. We've got to have this. We've got to make this happen. All right, let's talk a little bit. As you know, we've devoted a lot of resources toward advancing this, and our membership is excited about this. They're educating, I know, legislators back home about it. And since you've come on board, have you seen evidence that these volunteer advocates are making an impact with members of Congress, having them receptive to our initiative?
Absolutely. I think the meetings that we've been in, we've seen policymakers at the highest level the Ways and Means Committee and the Health Subcommittee there, as well as some of the Energy and Commerce members. And every time we go in and talk about the problem, like, oh yeah, I've heard about this from back home.
Mm-hmm.
And that's exactly what you want to do. You don't want this to be a Washington, D.C. solution. It's going to be something that they're hearing about back home.
Mm-hmm.
And then they can affect change here in Washington, D.C. But if it's about here, it's not the right answer. It really needs to be about back home. And in every single meeting we've been in, that has been brought up. So that's fantastic.
Yeah, and I mean, as cynical as anyone can get about politics, and it can be, a cynical business. Without grassroots, it's really difficult to get anything done. Members of Congress, I know people don't want to believe, but they do listen to the constituents. They do pay attention to the mail reports. They do pay attention to the phone logs. So it's important for them to hear from their members of Congress or from their constituents about how important this issue is to them, on a regular basis. A steady stream of calls and emails and handshakes at town halls when you see them back in the district are vital to getting this effort some momentum and getting it across the finish line.
Yeah, and as you folks know, we've been working at this now for several months, and we've started pretty much on the top end. We've started with Chairman Brady of the House Ways and Means Committee, the primary committee of jurisdiction for this bill. We've started with him. We've worked with Peter Roscom, who's the chair of the Health Subcommittee. We've worked with others on the committee as well. We've really kind of handpicked right now where we have been focusing our energies on this. But I think once this bill is introduced, it's going to be Katie bar the door. We're going after everybody.
Absolutely.
We're going for all 435 in the House. And we'll talk about the Senate a little bit later. But every co-sponsor on that bill, the more co-sponsors we have, the greater the likelihood of our success. I mean, that's a given. So we've been pretty, I'll say, strategic in working with a select number of legislators, especially those on the committee. But once this thing is introduced, boy, everybody is really going to be, everybody's going to have to be contacted and have their hand put on a handshake, like you said, and even more than that.
Yeah. I mean, it's just important. Co-sponsorships are going to be a little bit easier to get than the actual legislation introduced, but it's not a lot to ask your member of Congress to co-sponsor a bill. They hear it all the time. It's good to follow up on them. The more pressure, the better. I mean, that's what they're elected to do. They're elected to answer to you, to the constituents. So as much as they can hear from us on how important this is to, from a priority standpoint, the better.
Well, and John, too, you mentioned Chairman Peter Roscom, Health Subcommittee Chairman. Remember, he took over just in January in that position. And we were very fortunate to have an advocate who already knew the issues, had talked to the chiropractors back home. So whenever you have these conversations, they may not be the top dog that day, but you never know in 2, 3, 4 years that they might, and those relationships really come home. And I think a chief example of that is Peter Roscom. I mean, we had an open door policy. We were able to get in and talk to him, had a great discussion about that, and he knew the issue.
Yep.
It makes it a lot easier for us to go up there when those members already know. So that was great work and a prime example of why you work so hard, getting to know your member of Congress. Like Tom said, make sure you're shaking their hands all the time.
And well, just to follow up on that too, one of the members, as you know, we're working with is a junior member from Miami, Carlos Corbello, junior member on the committee, but he's very aware of this. And Carlos he's a workhorse, and he someday is going to be rising up the ladder. Linda Sanchez is another example, a junior member on the Democratic side. So that's a great point, though, because these people may not be the big cheese one day, but they may rise to the top in short order, because nobody saw the Pat Tiberi retirement, who was the former chair, and he retired in the middle of the term, and then it came to Peter Roscom, who when Tiberi stepped down, was not everybody's. Oh yeah, it's going to be Roscom, and he wasn't automatic. So you make a great point. These members, especially these junior members. Now, we were in with Carlos pretty early when he wasn't on the committee. And, you look at these guys and these folks and you say, well, geez, where are they going to be in 3-4 years? And here he is on the Ways and Means Committee. So we picked the right horse at that one.
Absolutely. He's a great guy.
Yeah.
Good point.
Let's talk a little bit. I hear this a lot. Well, why don't we just go for opt-out? You know, we're sick of Medicare. We've been doing this. This has been the problem now for over 40 years. It's never going to get fixed. And the opt-out is we talked a little bit about this before we came on camera here, that the opt-out is really not the panacea that a lot of people think it is. It's less than 5% of providers that are eligible do opt out. And when you do opt out, I think it's 2 years before you can get in.
Yep.
And so it's not like, okay, well, 2 weeks after you opt out, like, geez, well, I think I want to get back in. You can't. You got to wait another 2 years. And Brian, we've talked about this, and Tom too, is that when there's not a lot of appetite in the Congress to give opt out to more providers. Is that?
I think that's absolutely right, and I think there's been also, I was fortunate enough to work with a lot of specialties when I was up at the Ways and Means Committee, and they always came to new ideas, and I think opt out was always one of those things that they wanted to try and do. But when the math came down to it, like I said, so few providers do it, and then they realize it's really hard on the beneficiary to make sure they keep coming to see them, that they end up saying, well, we don't actually want to opt out, or that's not a policy we want to pursue. So we want to stay in Medicare. Yeah, there's challenges, but we want to work through those challenges. Can you help us? So I think at the end of the day, I get it. A lot of providers are put under a lot of pressure in Medicare. But at the end of the day, I think they come out and say, no, let's work through these problems. And that's why I think the parity for you all is the right issue. We've got a great message. We've got great issues to work on. We get a bill introduced, start working it, spread that message, and I think that'll make things a little bit easier for us.
Yeah, that's a good point. And we're all former staffers, and Hill staffers. And I'll put my old staffer hat on, and if I had somebody coming in, and I think you guys will agree, if I had somebody coming in and say, look, I want to have more access, better access for my patients in Medicare, by the way, I want to opt out too. I'd be like, which is it? Which one do you want, right? I mean, you can't run this on parallel tracks.
Yeah.
And I think once we get the full scope, the full parity, then we can go back and explore the opt-out issue. But for right now, even our House of Delegates has said that, let's get full equality, full physician status in Medicare, and that'll be an issue for another day.
Yeah, absolutely. And the other thing that I'll say to you is that the discussion about what Medicare providers should be doing and how that relationship works with both the program and the beneficiary is changing. It's not the discussion we were having even in 2002 when this kind of reared its head last. It's really about value and how do we have physician engagement at the local level. And I think that's another area where you all have a great job and great opportunity to prove real value as part of a larger healthcare ecosystem. And I think full parity enables that conversation. Unfortunately, an opt-out kind of puts that wet blanket on top of it.
Right. Good point. Let me, I hear this a lot too. Is like, well, what can I do? What can I do? And one of the things I say is that we have a grassroots petition program in place right now where folks can sign up their family, their friends, their patients. And that in turn will turn into a database so that when this is dropped in the hopper, we can go back to those people and have them contact their member of Congress. I still think that's a good thing to build up that database. I hope you guys agree. We have it. It's still active. It's acatoday.org/equality. You go there, and it's all the information is there. It's very easy to sign up your patients. We've been doing this, now for almost 3 years, I think. Like any type of grassroots program, it kind of gains steam, loses steam. You try to keep people engaged. And I hope that people are still engaged in this. I know doctors who just put a laptop in their waiting room and ask patients to sign in.
That's a great idea.
And make them a part of the solution. Yeah. Make the patient part of the solution. Because as we all know, this is for greater access, for them. That's I think, one thing that doctors can keep on doing. Another thing is to also start, we've started improving, continue the improvement in our documentation. This has always been a bugaboo. I tell you, can't sweep it under the rug. I mean, we are #1 in the hit parade in Medicare documentation in the error rates. It's gotten a lot better though, as you know, over the last 3 years, it's come down almost 25%. And doctors I know have been working to get that error rate down. However, we're still #1, for providers, but we're getting that down, and members of Congress are seeing that. They understand when we show them the CERT data that the numbers are coming down.
Yeah.
So that I hope that's a good message as well.
That's a great message to say, look, and I think there's a lot of credit to the organization and ACA for really taking this head on and spreading the word that we need to do that. There's been other groups that are on that high cert list, and they've buried their head in the sand, and that doesn't help anybody. Here we've identified a problem, we're doing something about it, we're being responsive, and I think the proof's in the numbers there is coming down quite a bit.
And that raises a legislator's eyebrows. We've both seen it in meetings that the documentation is the error rate's getting better. And folks, we have on the front page of our website, we have now a whole menu of webinar education series programs that you can take. One of them is Medicare documentation. You go to the home page on our website, acata.org, and you will see that. You will see that right on the front page. You just go down the menu and you see Medicare documentation. It's very easy. I think we're going to have some questions that have come in, and then we'll wrap up. How's that?
Sounds great.
Okay. Here's a question. Can you talk about the expected environment in the House after November? Yes, we can, but our guess is probably our crystal ball is fractured.
It's cloudy.
It is as cloudy as the weather outside. But that's a great question. I'll let you guys start.
I would just say, what you're reading is probably what we're hearing too. It looks like the Democrats are kind of in good shape to take the House, but it's a long ways to go. 60 days is a lifetime in politics. Anything can happen. You have hurricanes hitting. You have all kinds of economic activity that could happen. So we'll see. I think there is a perception, though, in D.C. that, or on Capitol Hill, that Democrats are probably about a 60-40 chance of taking the House of Representatives. And if that was to take place, there's a lot of open questions of who would be the Speaker. Does Nancy Pelosi have the votes to secure the Democratic speakership? Who would be the chairman, the subcommittee chairman? But right now, what we're going to work with is the kind of the hand we're dealt, which is that the Republicans are in charge for now. We have great relationships with the Ways and Means members that we're talking to about this piece of legislation. So we'll just keep it on. If the landscape shifts in November, we have deep bipartisan relationships with both Democrats and Republicans. So I think we're poised for success.
Well, as a firm's in-house Republican, I think I take a little bit more cheery view, but I think Tom's right that it is an uphill climb. Democrats are firing on all cylinders. They've got a lot of areas they're looking to expand the map. Republicans have an unprecedented number of retirements at the highest level. We've got the Speaker of the House retiring. We've got a lot of committee chairmen retiring. It's not a good playing field. So, even if I think Republicans hold the House, it's an uncertain November, much like if the Democrats take over, who's going to be in the leadership, who's going to be taking over the committees. I think the same questions are going to be asked on the Republican side. Paul Ryan stepping down, does Kevin McCarthy take over, Steve Scalise? So when you think about lame ducks, as we like to call them, after the election, those scenarios, they're always uncertain. But the level of uncertainty this year coming into it is pretty amazing. So like Tom said, you've got to look at the hand you're dealt. We're going to keep working on what we have and be poised to move in a different direction as soon as we see that. Though as close as races have been in the past, I'm not sure it's going to be the day after Election Day. It may be a few weeks.
Yeah, that's right.
Just never know.
It's happened. And I think I just want to reiterate, though, on the point you guys have made, that it's not that we've worked primarily with the Republicans. We have worked hard on the Democratic side of the aisle, too, on the Ways and Means Committee. We've got a lot of good friends over there as well. A lot of folks that are very in tune with this issue, that are very educated about this issue. They have chiropractic colleges in their districts, some of these folks. So we've worked on both sides. Probably about, when you go down the columns, both the R's and the D's, we've worked pretty much the same on both. So, and I think the folks that we have been working with are pretty safe. Now we talk about Carlos Cabello again. He's going to be in a tough race, but they're pretty much the folks that we've been working with. I think are solid.
Right.
And I think they're going to come back. And even if it does change, you got Richie Neal, who'll probably be the Ways and Means chairman. He's aware of this. He knows what the issue is. And but boy, I tell you what, if somebody asked me to put money on this one today, I wouldn't put a plum nickel on it.
Seems like a 50-50 ball game here. So
Yeah. Well, look, for one last thing I have to do before we wrap up is give a plug for our National Chiropractic Leadership Conference that'll be coming up shortly after these new folks come into town. We're early this year. It's going to be January 16th through 19th here in Washington, D.C. And this is the annual meeting of the ACA. And not only do we spend a day on the Hill, but we have all sorts of education and governance and all sorts of good stuff going on. So you go to our website, acatoday.org/NCLC 2019. All the information is on there. You can still get in on the early bird rate.
there it is. Yeah,
Okay.
perfect.
Brian, John, thanks.
Yeah, thanks for everything.
This has been great.
Yeah.
Let's do it again.
Yeah,
Thank you all so
Thank you
much.
very much.